this video, we will show an exercise in sitting position for patients with cerebellar ataxia. We are going to carry out this exercise in a sitting position on a treatment table. We will begin with basic and preparatory exercises in which trunk control will be prioritized during static sitting, and then with basic movements performed in a controlled way. The last activity will consist of putting the rings on a pike. First, we will ask the patient to maintain a static sitting position, with the trunk upright and looking forward. We can see in the video how the patient is sitting with his hands supported on the treatment table. And now we can see the sitting position with the support of the hands on the knees. Secondly, we ask for a dynamic sitting position, asking him to perform controlled movements of the trunk forwards and backwards. The physiotherapist can place her hands on the patient's sternum and dorsal area and work this movement in a resisted way. Or this movement can be assisted. Other trunk movements can also be performed, such as lateral bending movements. In this case, we will observe the patient's balance reactions. Rotations can also be performed. Thirdly, to continue with the preparatory exercises for the functional activity, we are going to ask the patient to perform an anterior shoulder flexion while maintaining a stable sitting position. Fourthly, we ask to maintain the position while turning his neck to the right and to the left. Finally, we are going to carry out the activity, which in this case is to put medium-sized rings on a pike. We will continuously remind the patient that the important thing is to be able to keep the trunk upright, and that the movement must be done slowly and in a controlled way.